Hi, so my name is Olivia Smith, and this is my presentation for EME 2040 on the use of iPads and apps in speech therapy. So for the introduction, as the world of technology continues to grow, the use of technological devices and apps have begun to integrate their way into the world of speech therapy. Through using an iPad in therapy sessions, speech therapists can make sessions more engaging and interactive for their patients. When working with kids or in a school setting, using an iPad and playing online games in therapy can be seen as a reward that will also reinforce what the child is learning in therapy. iPads offer speech therapists with an easy way to make assessments and do patient treatments, causing them to no longer carry around bags of physical games and assessment sheets, as it can all be now stored on an iPad. So how iPads and apps are integrated into speech therapy. iPads are used in therapy sessions to make patient assessments, video patient progress, use visual concepts like YouTube videos or pictures, or to play therapy-related games through apps. iPads make therapy sessions more engaging and interactive for patients, especially the younger patients. Speech therapy apps like Articulation Station and WorldVault can be used in therapy to help patients with speech sound delays and articulation. And speech therapists can also use apps such as SLP Goal Bank to create goals for their patients and use it as a resource to track their progress. So how iPads and apps have changed speech therapy. In the past, speech therapists played physical games that they had to drag to each therapy session, but now multiple games can be stored in apps on one small space through a portable iPad. So speech therapists also used to have to do data collection for each patient by hand in order to show how therapy has helped them over time, but now many of the apps have built-in data collection features to support managing many students on a caseload, which is very helpful for a speech therapist and convenient. And before, patients would practice their sounds outside of therapy with practice sheets or physical homework their therapist would give them, but now many iPad apps offer immediate visual and auditory feedback for correct and incorrect responses, thus making practicing at home a lot easier, and this is a lot more helpful for the speech therapist. So using iPads and apps in speech therapy, the advantages of this is portable, engaging, and interactive. It's an easy way to track progress over time through taking videos of them during therapy sessions and seeing how they progressed through each video. And visuals and videos help patients better understand certain concepts and see their progress, which is helpful for both the therapist and the patient. Disadvantages of this could be that iPads are more expensive than using physical games or evaluation sheets. They could have technology issues. Sometimes the apps couldn't be working or the videos could lag. It also lacks social interaction through having the child just play games on the app. It helps to talk to them during it. And then apps can lack actual educational value. Sometimes the apps are just fun and games and they aren't actually teaching the kids anything, which is not helpful. So the future of iPads and apps in speech therapy, I believe it will be integrated more and more into therapy sessions in years to come. The physical games therapists have been using in the past few years, those will turn into apps or digital downloads only that will be easier for them to take to different therapy sessions. And the convenience and availability of this technology will change the face of the entire profession for the future. I think that in the future, speech therapists will no longer use physical games or evaluation sheets. They'll do everything through iPads and tablets. So my personal thoughts on iPads and apps in speech therapy. Once I'm working the field, I'm sure there will be even more speech therapy apps developed and a higher demand for iPads in therapy sessions than there are now, so I will definitely probably be using one when working with my patients. And I think that using apps and iPads in therapy sessions is a useful tool that can make therapy more fun and engaging, especially for children if you're working in schools or with children as your patients. And I'm preparing myself to incorporate this into my work life by researching the best apps speech therapists use for different speech disorders and figuring out the best way to store patient progress and data on an iPad so it'll be more convenient in therapy sessions. So in conclusion, overall, I believe that the use of iPads and apps in speech therapy sessions is a very useful technology. I think that it allows therapy sessions to become more interactive and engaging as they follow the developing society and integrate technology into their field. iPads and apps offer speech therapists with an easier and more convenient way to track patient progress and data, allowing therapy sessions to be more organized and reflective for both the patient and therapist. The use of this technology in this field of speech therapy is overall very beneficial, and I think it'll become more useful as time goes on. So here is my final video reflection that I recorded and posted to YouTube. Hi, so for my final reflection, for the first question in EME 2040, I learned how to use many different technology softwares like Pictochart and Powtoon. And then throughout this class, I grew by getting more comfortable and integrating more technology systems into my presentations and assignments. Before this class, I did not know how to make animated PowerPoints or infographics, so it taught me that, which is cool. I found making the presentations fun and easy, but narrating the PowerPoints was pretty difficult for me. I believe that my work improved throughout this class as I began to get more comfortable with different technology systems and working on my computer. I will remember after this class how to narrate PowerPoints and screen record because this is something that I've never done before, but I think will be useful in the future for presentations for both school and work. And after taking this class, I feel more confident in my ability in using technological systems to make presentations and integrate it more into my daily life. Thank you. And there are my APA sources. And that is all. Thank you.